Hi, I'm Katya, and I'm going to be doing my health assessment video today for validation. First, I'm going to wash my hands. I'm going to wash my hands for about 15 to 20 seconds. Sarah, we like to keep this with us. I would assume, but I didn't know if we had to pretend like, oh, I have a pretend imaginary computer screen. Dry my fingertips down to my wrist. Well, that's why I'm asking if you were allowed to have.
Right, so like having this.
And now I'll go greet my patient.
This, which is basically, doesn't have the notes on it, but it's just.
Hi, Carissa.
Hi.
Hi, Carissa. My name's Katya. I'm going to be your nurse today. I'm doing your assessment.
Okay.
All right. And how are you feeling today?
Good.
Good. Are you having any pain?
Nope.
All right. Let me just go ahead and deep. And your first and last name?
Carissa Otrado.
And your date of birth?
11/21/97.
Excellent. All right. Come with me. Do you have any allergies, Carissa?
No.
All right. Excellent. We're going to go ahead and get your height and weight. And on a scale of 1 to 10, are you having any pain?
Nope. 0.
Excellent.
Obviously, I
All
know what you're
right.
doing.
We can get on the scale.
But talk to the mannequin, like, to me. So you can say, okay, I'm gonna do this. Is it okay if I move your shirt down to
Thanks.
something
You're
like that, just as
130 pounds.
So those
And
kinds of-
go ahead and get your height.
That's what we're going for. It's not to like, be super nursing.
And you can move your head over.
Or get familiar working,
Okay. Like that.
you know,
And you are 5 feet.
it's just
And your BMI was 25.6. And we're going to go ahead and get your waist circumference, okay? And we get it right from the belly button. We can make sure that it's accurate. And you're at 29. So you're under 35, which is exactly what we want within normal limits, okay? All right. So I'm going to have you do some walking to me. I'm going to assess your gait and make sure that it is steady.
Okay.
And while assessing my patient, her appearance is clean. She has a good affect. Her speech is appropriate, and she's dressed appropriately for the weather. Now, Carissa, you know what you're here for today?
Yep, my yoga physical.
All right, today's date.
The 24th of January.
And what time is your appointment?
11:30.
And my patient is oriented times 4. Oh, oriented times 4. All right, Carissa, I'm going to have you do some heel to toe walking towards me. Excellent. And now, can you walk on your toes? And now on the heels of your feet. Okay, excellent. And I'm going to assess the curvature of your spine, make sure that there are no abnormalities.
All right.
So if you could reach down and touch your toes. Okay. All right. Hips are symmetrical, shoulders are symmetrical, there are no spinal abnormalities. And we're going to do some range of motion, okay? Now, reach out and touch your nose. All right. Rotate your arms. And now I'm going to have you rotate your wrist, your elbows. Pick up one leg at a time. Okay. Other leg. Excellent. And your ankles. Rotate your ankles. And the other one. Excellent. All right. And I'm going to have you turn around and close your eyes. All right, so stand steady. My hands are going to be to your side. Eyes closed. And I'm assessing for any swaying doing the Romberg's test. And the Romberg's test is negative. All set, Carissa. Thank you. All right. If you could have a seat. Okay. And I'm going to check for your strength, okay? So I need you to grab my fingers and squeeze. Excellent. And push up on your feet. And push down. And push up. And gasp up. Excellent. Thank you. My patient has equal strength bilaterally on her hands and feet. All right, we're going to assess for your cranial nerves, okay? So if you could smile, frown, wrinkle your forehead, and move your shoulders up. Excellent. And puff out your cheeks. Thank you. Cranial nerves 2 through 12 are intact. Now I'm gonna check for your, I'm gonna assess your hair, your head and your neck.
Okay.
Alright, so I'm inspecting her head for any lesions, any abrasions, any lumps or masses. And I don't observe any. I'm going to palpate her scalp. Alright. She has equal distribution in her hair. Her hair is dark, it is thick, and her skin feels warm and dry. I don't observe any lesions on her skin, no abrasions, no masses or lumps. Alright, now I'm gonna assess your eyes. Okay, so I'm just gonna pull down on your skin and assess your conjunctiva. It's pink and moist. Sclera is white, pupils are visible, iris is visible. And, alright, so first I'm going to shine a light in your eye. Without looking at the light, just keep looking at me, okay? Okay.
I'm here to help whatever way I can. What do you want me to do?
Excellent. Pupils are reactive to light. And look at the light and look at me. Look at the light and look at me. Excellent. Alright, now we're gonna test your accommodation. Just look at the light. Alright, her eyes are converging. And pupils are equal, round, reactive to light and accommodation. And without moving your head, look at the light. I'm gonna move it, okay?
Students, so no waterboarding when they get stuff on.
Excellent. Extraocular movements are within normal limits. Alright, and I'm gonna palpate, inspect the ears. So upon inspection, I don't see anything abnormal, no lesions, no abrasions, no masses. So I'm gonna start palpating the pinna. I don't feel any masses. And if I had an otoscope, I would pull her pinna up and back and observe the tympanic membrane and ensure that it is pearly gray. And I don't observe any drainage. So now I'm gonna inspect her nose, make sure that it is symmetrical. And I wanna make sure that there's no deviated septum. Clarissa, could you hold one side of your nostril and puff out a breath? Excellent. And the other side. Excellent. Her nose is patent, symmetrical, and I'm gonna check for drainage. Alright, no drainage noted. Now I'm gonna inspect your oral cavity. I'm going to inspect her teeth for any dental caries, her buccal mucosa for any lesions or abrasions. I'm gonna check her tongue for any white patchiness, and I'm gonna inspect her uvula, make sure that it moves up and back, and also inspect her hard and soft palate and make sure that those are intact.
Get in my room.
Alright, Carissa, if you could open your mouth, please.
Everybody watch her.
Alright, no dental caries, tongue is pink, moist, buccal mucosa is moist, and say ah. Alright, uvula moves up and back, hard and soft palate are intact. Alright, now I'm going to inspect your neck, make sure that it is symmetrical throughout, and I'm going to palpate, okay? Are you feeling any pain at all? Okay, very good.
Why do you hate me?
Alright, and just swallow. Alright.
Pay Frank off.
Trachea is intact and thyroid is non-palpable. I'm gonna check for your lymph nodes, okay? Preauricular, postauricular, submaxillary, and supraclavicular. And now I'm just gonna pull up your skin, okay? For skin turgor and no tenting noted. So you're well hydrated, okay? And, okay. So from here, I'm going to assess your respiratory system, okay? Have you had any difficulties breathing, anything at all? Nope. Okay. So upon assessment of her skin is clean and dry, checking the temperature, and she's warm. And now I'm going to auscultate her lung sounds. Okay. Nice deep breath. Excellent, lungs are clear. And now I'm going to percuss your chest. I want to ensure that I hear resonance, okay? All right, resonance is heard, and that's within normal limits. I'm gonna go ahead and assess your respiratory on the back.
All right.
Okay. All right, nice deep breaths. One more. And again. And again. And one more deep breath. Excellent. Lung sounds are clear, no adventitious lung sounds noted. Now I'm also going to percuss her posterior thoracic. Okay. Excellent. Excellent. All right, Carissa, I'm going to check for tactile fremitus. I need you to say the words 99.
99.
One again.
99.
And one more.
99.
Excellent. Tactile fremitus is higher and becomes lower as I move my hands down. I'm going to check for thoracic expansion. Okay, so I'm at the 10th intercostal area, and I want to make sure that my fingers expand 1 to 2 inches. Take a deep breath in. Okay, so my fingers expanded about 1 inch. So her tactile fremitus and her thoracic expansion are within normal limits. And upon inspection of her back, her skin was clear, dry, and warm. No evidence of any masses, abrasions, or abnormal lesions. Okay, so Carissa, any pain at all? Excellent. All right. I'm now going to assess your cardiac system. Okay, so if you could lay back on the bed. Okay. I'm going to listen to your heart. Okay. And first, I'm going to let you know what parts of your heart I'm going to listen to.
Okay.
Okay. So at the second intercostal space on the right sternal border is her apical pulse. Second intercostal space on the left sternal border, aortic. Second intercostal space is her pulmonary. The third intercostal space is Erb's point. And her fifth intercostal space would be her tricuspid. And at the mid-clavicular line, I would find her apical pulse, or mitral, also known as the point of maximal impulse. So now I'm going to listen. First, I'm going to listen with the diaphragm, and then I'll listen with the bell. Okay? And just breathe normally as you normally would.
Well, one of them doesn't have. She got the one in the middle. Oh, okay.
Yeah. The rest of
I
it
was
is
wondering, yeah, because I saw the stickers over here. Oh, okay, yeah, because I'm like, there's
Sorry, I'm going to move your bra.
It's okay.
Excellent, very strong. Okay, heart sounds are strong and regular. Now I'm going to listen with the bell. And I'm listening for any bruits. Okay? So I'm going to lift your bra again.
Okay.
Excellent.
Hi, my name is Amanda. I'm
And,
a nurse
sorry.
today. I saw that your call light went off and you're having some trouble breathing.
Okay.
I'm gonna
Third
start by
intercostal
raising
space.
the head of the bed.
At Erb's point, back up to pulmonic,
And I'm just gonna start off with a little respiratory assessment.
and back at
So
the
I'm
aortic.
checking to see if the patient, if you have any labored breathing, if your chest is rising.
Okay.
looking for any
So no signs of bruits, heart sounds
of your accessory
are strong.
muscles. And I would also
Okay,
inspect
so
the
I have
posterior
inspected and I have
thoracic wall.
auscultated her
Understood.
sounds.
Stop. You get one.
And-
Do not do what with the interior.
Okay, so now we're gonna check your capillary refill of your hand and your feet.
I'm sorry.
Alright.
That's right, so one more.
Okay.
Alright, capillary refill is back within less than 3 seconds. And I'm just gonna check one of your feet. Your feet are really cold.
They always are.
Alright, capillary refill is returns
get that.
within less than 30 seconds. Okay. And sorry, I just need a second. Alright, now we're gonna go ahead and I'm gonna do your pulses. Okay, so I'm gonna start at your temporal, move down to your brachial, radial, dorsalis pedis, and your posterior tibialis. Okay, I wanna make sure that your pulses are strong, equal bilaterally. Alright. Right after this, I'm gonna do your carotid, okay?
Begin sim.
Hi, my name is Amanda. I'll be your nurse today. Can I just have your name and date of birth, please?
Frank Hotel 1122 there, thanks.
Alright.
So I saw the Bill call light went off here. I had some trouble catching your breath. I'm just gonna start by raising the head of the bed.
Alright, Carissa, so
And
your
I'm just gonna
pulses
do a
are
quick
strong,
respiratory assessment.
equal bilaterally. Now let me go ahead
just
and I'm gonna auscultate your carotid. I just need you to hold your breath.
Okay.
For a couple seconds. Make sure I listen to it with my bell. I'm listening for any bruits.
A use of accessory
Alright.
muscles, and I would also then inspect the posterior thorax. And next, I'm just gonna
Okay.
palpate the front of your chest, just for any bumps and abnormalities.
Okay. And while I was
And I would also
listening to
palpate
your
posterior
carotid,
thorax.
I saw that you had moved your
And
neck,
I'm just gonna listen
and I
to
don't
your bump
see
sounds.
any
Just gonna
jugular
put on your account.
distension. So negative for JVD. Okay, now I'm going to assess your abdominal. Have you had any nausea or vomiting at all?
No.
And you're feeling all right throughout all this?
Yep.
All right, if you feel any pain, don't hesitate, let me know.
Okay.
All right, let me just see if you've got any edema down here. All right, no signs of edema.
Hear a little bit of,
All right, so I'm gonna inspect your abdomen. Do you mind lifting up your shirt just a bit?
Posterior
Okay.
thorax.
So upon observation, I see that her abdomen is flat, no distension observed. Her skin is
Put this pulse oximeter
warm,
on your
dry,
finger.
and Carissa, so now I'm going to listen to your bowel sounds. Okay, I'm just gonna move your bed
You're trying to get to
up.
do that.
Okay. I'm gonna start at the right lower quadrant, the right upper quadrant. And I'm listening for 5 to 30 gurgles per minute.
So it looks like your pulse ox is 85. I'm just gonna check the doctor's orders. And it looks like, with your pulse ox being below 87, I'm going to,
Okay.
apply a Venturi mask to you.
So your bowel
At
sounds are active.
35%, 8 liters per minute.
And I'm going to percuss, so I'm listening for tympany, okay? Excellent. Okay, so bowel sounds, and your also the percussion, I received tympany back.
Okay.
Now I'm going to palpate, okay? Just let me warm up my hands,
All right.
sorry. And what I'm doing for this is I wanna make sure that I don't feel for any masses in your abdominal area, okay?
Okay.
If you feel any pain at all, just let me know.
Liters per minute. Make sure there's no kinks in the tubing.
And that's light palpation. All set?
Yep.
Alright, so now I'm gonna deeply palpate. What I'm doing is I'm using my top fingers to feel for any masses. Alright, no masses noted. And,
Making sure.
okay, so that's all, that's it for your abdominal assessment. We've done your cardiac. And, let's see, oh, actually, there is one more thing I forgot. Let me go ahead and check your reflexes.
Okay.
All right.
Okay, now we're
So,
going to reassess the patient.
I wanna make sure that your feet are not gonna flare.
I would do another inspection. I see that the oxygen is helping.
All right, no
The
flaring on that
chest
foot.
isn't rising as bad. Looking for tracheal
Hey,
tugging.
we're good.
Nasal flaring.
All right.
Good accessory muscles.
And that was the,
Palpate. And auscultate.
Babinski
6
reflex,
points
yes.
on the anterior thorax
All right,
and
so that concludes the assessment for my patient.
posterior
Let me bring your
thorax.
bed down.
And I also see that the pulse
The
ox
patient
is
is
rising.
a healthy
Now 92.
19-year-old female.
We
Thank you, Carissa.
can
You're
apply
welcome.
nasal